Good afternoon, everybody, or good morning, depending on where you're located. My name is Kevin Burgess. I am with the revenue team at Ameriflex, and we want to start by thanking you for taking some time to join us today for 30 minutes. And I'm going to be very, very brief and then get our main presenters to you. There's an old saying that says the road to hell is paved with good intentions. And we certainly see this in our world often. Most people that put benefits plans together have really good intentions. And usually their good intentions are to do something great both for their company as a business and then do really good things for the people that work for them. And all too often these are conflicting priorities. And Jason and Rashmi, they're part of our team here. They're going to talk about that in a minute. But those conflicting priorities sometimes result in a plan design that I'm not going to say it's hellish, but it can certainly be painful. And a portion of the business that comes to us every day comes to us because people are frustrated with their plan. And so they come looking for us to solve a pain point. And so we see firsthand the frustration and the bad results of plans that were designed with the best intentions in the world of serving both their business well and their workforce well. And so that's where this webinar came from. We see these plans, see the results. We want your good intentions to result in a good plan that satisfies your highest priorities. And so to talk about some of the stuff we see on a regular basis and how you can avoid it, we have two really, really great people. Rashmi Dairyman, she is our Director of Client Experience. Jason Icabellis is our Director of Operations. Together they have over 20 years experience in this industry. And I know you look at their picture and you go, how could two people in their 20s have that much experience? We just started them working really, really young. But they're fantastic, and they have literally seen it all. And so they're going to talk to you about kind of the worst of stuff that happens, how it comes into being, what the results are, and how you can avoid it. So thank you for joining us. Jason, Rashmi, it's all yours.
Thank you, Kevin. Hi, everyone. This is Rashmi. So you may be asking yourself, well, how do I know that my health benefits plan design is bad? Well, it's simple. Your employees will tell you, or they just won't use the plan. The reality is most employees don't understand insurance in general, just because by its nature it's complicated. A recent study that was conducted by Policy Genius showed that 96% of Americans don't understand the four most basic health insurance terms, like deductibles, coinsurance, co-pays, out-of-pocket maximums. And only 4% could actually accurately define all four of these terms. So during an open enrollment meeting, just when you think you're educating employees on the ins and outs of what a great plan you might be offering, the reality is that employee is probably walking out of that meeting just as unsure of their health plan as they were before they walked in. So in our experience, what are some of the common complaints that we often hear from a bad plan design? Well, let's take a moment and take benefits out of the equation. Imagine you're an employee, you're at the store, you're waiting in line, ready to check out and pay for your items. It's an experience that we have on a daily basis. You swipe your debit card, and the cashier says that dreaded phrase to you, your card has been declined. Putting yourself in that customer's shoes, imagine what's going through in that employee's head in that moment. It's usually a mix of emotions, ranging from embarrassment, anxiety on how they're going to pay for the expense, insecurity over if they understand how to use their card or their plan, and also pressure to figure out a different method of payment and figure it out quickly because there's probably a line of people standing behind them. What then happens is this then steamrolls into having to call their provider once they leave the store, or even worse, having to go to the HR team and most likely complain. So they're left feeling embarrassed. They're making calls that they didn't expect to make. They're complaining to their HR team. And then ultimately, they have this benefit, but they're not going to use it. So when that employee goes to their HR person or is talking to their coworker by the water cooler, the conversation isn't going to be our health reimbursement account stinks. The conversation becomes our benefits stink. And as we all know, great benefits lead to higher employee engagement, increased employee retention, and also helps with recruiting great talent. So why do you want to steer clear of a limiting, complicated, or just overall bad plan design? Because here's what's at risk: lower plan enrollment, decreased employee engagement, and ultimately the reputation of the HR team, as well as their benefit consultant, is on the line.
Thanks, Rashmi. This is Jason Yacobelis here. Thanks to everyone for joining out there. We're going to talk about some different personas. Rashmi and I spend a lot of time talking to our customers, our brokerage partners, our consultant partners, our HR partners, and we're going to discuss a lot of the items that come up on a regular basis. So those of you that are Office fans, we have HR represented here with Toby from the office. And when we do talk to our human resources partners, managers, directors, analysts, you guys have a lot on your plate. And keeping benefits at the top of everyone's mind can be difficult. And I just want to give you guys a shout out. We have a ton of respect for your role. Everyone out there, give you credit because we know it's not easy and there's a lot of things being thrown at you. So when we do look at day-to-day administration of plans can become an administrative burden or time vampire at a blink of an eye. And there is opportunity to simplify in these areas. And you'll kind of sense a theme, but Rashmi had mentioned it earlier. Simple plan designs are key because they not only help with engagement, retention, and recruiting, but they also help build momentum around the culture strategy of an organization. I was pulling some stats over the past week in preparation for this, and I found one. It said 36% of businesses see engagement as a top challenge. Benefits contribute to this and also contributes to the overall strategy of the organization. So now the key thing is finding balance, and there are many things that play into this. So if we look at benefits packages, engagement is linked to this. Simpler the better. We've seen this in surveys as well as discussions that we've had with many of our partners. So when a plan like an HRA is easy to understand, it's going to pay dividends in the culture arena. And this kind of goes back to the overall arching recruiting and retention theme. So this can all play together and help with that formula. Going back to that 36% of businesses see engagement as a top talent. A lot of this can contribute there. So administration is key, and that's the work that you have to deal with at an HR level. And this could be how a plan design is and built out. So making slight changes around coverages or how a plan is going to work or how a plan can coordinate with other benefits can be the difference between set it and forget it or a line of employees outside your door or follow-ups with vendors or a big pile of paperwork that we have to go through and figure out. So these are some important things to take into consideration, as you kind of look at open enrollment season. So next we're going to go to the finance office, and we have Angela here. So on the finance side of the house, we all know that cost and the bottom line is at the top of this department's mind. Benefits are a large expenditure. I don't know if we have any finance team members on the line or any CFOs. I know you guys are a big part of the decision-making process because it is something that hits the balance sheet. So it can feel like a balancing act. So HRAs, for example, that's a good way to find balance. But there could be some other financial impact with a plan design when we look at this. And it could be because a plan is not simple to use or easy to understand. So looking at all things, one thing to really take into consideration is, are employees churning up time during the day, having to decipher what's covered, what's not covered, or go through documentation, or designing their own roadmap to get reimbursed? Ultimately, your operation is going to lose time. And that's not the whole point of benefits. The whole point of benefits is for it to be a benefit and for people to be able to have peace of mind to use it. So we like to call this sometimes the decoder ring phenomenon. You need a decoder ring or a map to figure out how to get reimbursed for your plan. And this also plays into productivity on the HR level and administration. At the end of the day, you guys want to be focusing on retention and recruitment and culture and all that good stuff. You don't want to be worrying about the paperwork burden again. So these are all things we have to take into consideration, not only what the costs of the benefits are, but what the other costs are as it relates to productivity. And that's from the bottom all the way to the top. So as finance leaders, we need to ensure that productivity and the return on investment components are taken into consideration when looking at the total, and I'll use quotes, cost of a benefits package. This includes depleting resources and ultimately losing productivity. So the next persona we wanted to talk about is our buddy Dwight Schrute. So anyone that watches The Office knows that Dwight has an opinion or a strategy or an initiative around everything. So when we put ourselves in our employees' shoes as it relates to benefits, we often hear from our plan administrators or see from our plan administrators that they sometimes have some detractors or they have promoters. Now, we all know our promoters and detractors. We've seen them at open enrollment meetings. We've seen them at benefits fairs, and the promoters are telling the story, how awesome the benefit is, how it's helped them. They're bringing up other employees to the table. They're raising their hand in the enrollment meeting, telling everyone how great the benefit is. Those employees are our promoters. Now, on the other side of the coin, we have our detractors, and sometimes the detractors are the ones that are telling a story that is going to make everyone cringe about the benefit, or maybe everyone's thinking that these benefits are not so good, going back to kind of what Rashmi was alluding to. Now, when we start to get to the root cause and we look at the facts, and Rashmi and I have spent a lot of time over the years kind of digging into these situations just to kind of figure out how we can make this easier and simpler. Plan administrators tell us, you know what, I just think sometimes it's that people don't understand the benefits. And then when we start peeling back the onion, we're like, well, we can simplify this or we can make that easier. So these are all things that we can get ahead of, and we can create every employee to be a promoter as we go through the process. So again, there's opportunity to find balance here when we evaluate the steps employees need to take to engage with their benefits. And ultimately, employees will promote the benefits inside and outside of the office, which then kind of plays into culture, retention, recruitment, and all the stuff that we read about in white papers. There's some low-hanging fruit here, and there's definitely opportunity when looking at this holistically. So at the end of the day, employees, our human resources professionals and partners, finance team members, we all want the same thing. Our objectives should align, but we still need a balanced budget. So we're going to be realistic here. We need a balanced budget and other needs, and every organization is dynamic and has different components to make their machine run. So there's no simple answer of, oh, just make it simpler. That's not what we're saying here. But there are ways to design a plan, or there's a different way of thinking when designing a plan to make sure that we're meeting all the expectations and requirements of the organization, but still having a good experience for our participants.
Okay, so just as a reminder, if you have any questions, please feel free to submit them through the chat box on your screen. So you may be asking yourself, Jason and Rashmi, that's great. You told us about why we shouldn't do a bad plan design or a complicated plan design, but what really consists of a good plan design versus a bad plan design? Well, in our experience, a good plan design is usually a simple plan design that gives people easy access to their money. Most Americans these days live paycheck to paycheck. And healthcare costs are just increasing year after year. So access and easy access to their money is crucial in order for an employee to feel like their benefits are working for them and ultimately that their employer is advocating for them. So in our experience, a good plan design usually gives a participant access to a debit card. It's not overly restrictive. We always say that the card that we use is a smart card, but it's smart to the extent that if I go to Target and I buy a loaf of bread or diapers, when I swipe that card isn't going to know the difference between if I'm buying a loaf of bread or if I'm buying a thing of diapers. So ultimately, we have to think about what the end user is experiencing when we're designing these plans. Good plans typically cover the most basic medical expenses, like deductibles, prescriptions, coinsurance, in and out of network expenses. Going back to my Target example, when a card is swiped, a card is not going to know the difference between an in-network expense versus an out-of-network expense. And a plan where the receipts and the explanation of benefits clearly indicate what that expense is, so that way when that participant knows that they have to submit a claim, there isn't confusion on their end as to whether or not the documentation I have to submit is in fact something that's covered. The less manual claims a person has to submit, the better. We don't want them to feel like the plan that's been offered to them is a burden. So in our experience also, some of the bad plan designs, like I said, are usually the ones that are the most restrictive. So for example, we will often get requests to do percentage payouts per claim, or embedded HRA plans where there's a cap per individual family member, or something even more restrictive like the health reimbursement plan only covering third-tier prescription expenses. Again, putting ourselves in our employees' shoes, when we're communicating the health plan at open enrollment time, sometimes that's several months before they actually have to use the plan. So it's requiring an employee to remember a lot of what they learned during open enrollment period 3, sometimes 6 months later when they actually have to use the plan. So when designing a plan, keep these things in mind. And a couple key points to remember when designing your plan: clearly understand the outcome you want and work with your broker or work with your third-party administrator to keep the plan design in alignment with what those outcomes you're looking for. If an engagement is a focus, then you're going to want to keep something as simple as possible. But if cost savings is your focus, well, that's something that your broker and an administrator can help work through with you. Keep it simple. Simple typically equates to easy in the employee's mind. And clearly explain your plan during open enrollment and why you selected that plan for your participants. And just when you think you have it communicated well, communicate it again. Again, open enrollment is a time when we communicate this information, but proactive and periodic communication throughout the benefits plan year will only help drive that education direct to your employees so they truly understand the great benefits that are being provided to them. So I'll kick it back over to Kevin.
Hey, thank you so much, Rashmi, Jason. We've got some questions coming in, so we've got a few minutes here that I want to kick those to you. And everybody that's listening, please This is your chance to pick the brains of a couple people that have seen it all. So, a couple questions that have come in. First is, are most bad plan designs kind of the result of a company trying to satisfy too many conflicting priorities?
Short answer to that question is yes. Typically what we find on the spectrum is there's a lot of parties that we have to please, right? We're typically dealing with owners of businesses that are trying to understandably control costs, maybe an HR team that's trying to manage engagement. And that spectrum has a varying degree of different plan designs that can fall within it. So it's really, I guess, the best way to approach it is first understanding kind of what the top item that you're looking to get out of the benefits plan is. And there's those varying degrees of where it could fall on that spectrum. That has to be the first guide in how you then back into a plan design. So from an engagement perspective, you may want to make sure that employees have access to a card. You may want to make sure that it's less restrictive. But if you're on the cost savings perspective, there may be some factors that you want to limit for an HRA plan, but there's ways to do that without being so restrictive. So for example, if you know that your financial exposure as a company is X amount of dollars, instead of putting burden on the employee of maybe having to only paying 50% of every claim, take a look at the overall amount that employer is looking to spend on this benefit, and maybe instead of restricting the health reimbursement account, just lower the amount that you're offering to employees, but still give them easy access to use that money.
So yeah, and I would have to agree with Rashmi saying. So I think the key thing with the conflicting priorities is one to prioritize what's the top, but you can balance financial priorities with engagement priorities by doing just that. And I know it may sound weird, but we've had experience with groups on who are leveraging HRAs to save money with their health plan by giving a little less in the HRA, and the perception wasn't that they were giving less to the employee. It was actually a more meaningful benefit because the employee didn't feel like they had to jump through 100 hoops to get reimbursed. So they actually had better engagement around their plan. That's one example of many that kind of play into the formula of balancing those priorities. So that's where we'd probably level set that.
Yeah, the last thing you want to do is give your employees a benefit but not get credit for giving them that benefit.
Absolutely. Got another question. This is from Laura. She said, the number one complaint I get from staff is that they hate uploading receipts for every single visit. The card isn't, quote, smart enough to know that it's a medical expense no matter how many times a provider is validated. How would you solve that?
Sure. Well, there's a couple different options that we have here at Ameriflex, and we try to auto-adjudicate as many transactions as possible. Ultimately, we know substantiations are a burden, not only for the employee, but also, it creates perception around wanting to use the plan. So with a lot of our auto-adjudication features, some of that includes the ability to auto-adjudicate all prescription expenses. Most pharmacies have what's called it's basically an inventory management system that codes prescriptions. So when an employee goes to a pharmacy, swipes their card, that card recognizes that it's a prescription expense and no receipt is required. We also have the ability to do copay matching features. So copay matching means if there's a set amount of copays that the employer has that are tied to their medical, dental, or vision plans, we have the ability to program that into our system. So again, it goes to the card recognizing that that's an approved copay expense, and then we can auto-adjudicate that and no receipts are required in those instances too. And we also have a recurring expense feature. So if an employee goes to a doctor Say they go to a chiropractor monthly and they pay $100 every month for that chiropractor. If they submit a receipt for that expense one time, our system knows that every single time they go to that doctor for that $100 copay amount every single month, they won't get requests to resubmit receipts for that same doctor and that same amount.
Excellent. Got another question from Donna. This webinar seems to be addressing only HRA plans. Does it also apply to FSA plans?
It could. It absolutely could. We've gotten some requests because ultimately what's covered and what's not covered is pretty standard for an FSA, but we have gotten requests in the past to limit certain items that are covered under the FSA. So it could apply to the FSA. In our experience, it's typically the health reimbursement plans that get pretty creative.
Yeah, and on the FSA front, that's a really good point. Many of us know that the FSA is kind of sometimes just an extra element at the end of a benefits meeting or part of the enrollment process. One recommendation we would have to simplify the full package and is to include the FSA when you pull up, depending on what type of health plan you have, but let's say you pulled up your copays, or you pulled up the vision benefit, or you pulled up the dental benefit, and having the FSA represented on all those slides actually helps it be a little simpler for the participant in understanding, hey, there are some out-of-pocket expenses here. So let's say like we're looking at the dental. Oh, this can help me with that. A lot of employees, they know kind of what's covered at a high level, but they think the FSA is an extra benefit. I always like to say to simplify the FSA, even though it's kind of a set standard structure and doesn't come in a lot of different flavors like HRAs do, that the FSA is more of a complement to every benefit being offered as long as it's covering all the basics. And, for standard packages, anything relating to deductible, hospital visits, prescriptions, all that good stuff, that's all covered by the FSA, your vision expenses, glasses, depending on what type of vision plan a group offers. Sometimes people want to upgrade their frames, but the vision benefit only upgrades frames every other year, and they only will do new lenses annually. Well, if someone wants to allocate some funds pre-tax to the FSA, they may not realize that even though they may say, oh, I can't get new frames this next year because of how our plan's designed, and this is just saying people have plans that are designed that way. Well, you can use the FSA for that. So to simplify the FSA, I would say represent it in every component of your benefits presentation or open enrollment meeting, and just not at the end and say, oh, we have the FSA too. It's really great at covering these types of expenses. People have to kind of see the big picture.
That's excellent. We've got 2 minutes, and so I'm going to throw one more final question out there. We'll wrap right at 12:30. Before I throw the question out, I want everybody to know we will be sending out the deck and recording of this webinar to everyone that registered for it. And also, if you would like us to talk with you about your plan, whether it is fulfilling all of your priorities, and if not, how it could, we would be happy to have that conversation with you. At the end of the webinar, you probably see it right now. We've got a site on our website. But the final question came in, and it's simply this: Jason Rashmi, I have an HRA right now, and I've been thinking of offering an HSA. Would you recommend us switching?
So that's a great question, and it comes up regularly. So it's not a weird question. It's a very common one. So there's a lot of different ways to look at this when it comes to plan designs and how you want to position the benefit. There's a lot of pros of an HRA, and there's a lot of pros of an HSA. HRA is 100% employer funded. Employers have a little more control of it. Now, in an HSA, an employer or an employee can contribute to that account, and it can be used for a wide range of things. An HSA is portable, an HRA is not. So our recommendation would be that really kind of take a step back and say, okay, as an employer, how much do I want to contribute to this component of the package? That's the biggest question I would say first. And if it's the majority of the coverage, in a higher deductible situation, an HRA may make more sense. But if you're giving a little less, or maybe you're saying, budget, we want to still provide a benefit, but we want it to be employee contributed, and we want the employee to be able to kind of use that money in a new and a different way, meaning because an HSA has an investment component as well, similar to a 401k, it may make more sense to go down that road. So there's no kind of silver bullet answer, I would say, but I would start with how much do I want to allocate as an employer to help offset costs, and then start peeling the onion back and kind of deducting what's priority from there. What would you say, Rashmi?
No, I agree. It's really, it goes back to clearly understanding the outcome that you want from the plan and how much employee involvement that you want in that decision-making process, or employee investment that you want in that decision-making process.
Guys, we are 1 minute over. I'm gonna let Jason Rashmi, we had a late question come in. I'm gonna let Jason Rashmi field it. Can you have both an HRA and an HSA at the same time?
Yes, you can. We have seen post-deductible HRA plans, and that's certainly something that we administer here at Ameriflex. But yes, you can have a HRA and an HSA at the same time. There's certainly additional rules that you would want to review in terms of how a post-deductible HRA would work in conjunction with the HSA, just because it would be a little bit more of an education piece to explain to participants of when they can use which account, but it certainly is an option.
Yeah, and when someone is thinking about a post-deductible HRA with an HSA strategy, there's nothing wrong with it, but to Rashmi's point, sometimes it does get a little more complicated for the participant, and depending on the needs of the employer and the overall strategy, sometimes it's better to complement an HRA with an FSA. And it kind of tells a similar story. Now, an FSA has different requirements, and it's not portable like an HSA is, so there's some pros and cons there. But sometimes it's a little simpler for an employee to understand kind of how that HRA and that FSA play together, just based on kind of the structures of the plans. And that could be how the plan, an FSA allows funds to be utilized day one, and HSA is more of a contribution payroll account that builds and builds and builds, similar to a standard type of bank account. So there are multiple different strategies and roads you can go down. But yes, to Rashmi's point, that's how those are structured.
Awesome. Thank you guys so very much. Again, if you would like to continue this conversation, you have specific questions about your plan or how to satisfy some priorities your organization has that you're not sure of it, please reach out to us. There's an address right there on our website, and someone will contact you very, very quickly. Thank you for your time, Jason and Rashmi. Thank you. Everybody have a fantastic afternoon.